Hello, my name's Faye George. Today we're going to be talking about the principles of infection prevention and control. The key learning points of today's training, we'll be talking about the basic understanding of infections, good hygiene, which include hand washing, the use of personal protective equipment, also known as PPE, disposal of waste, and keeping the individual and yourself safe. Infections. Infections are caused by germs such as bacteria, fungi or viruses entering the body. For example, MRSA, TB, E. coli, influenza, C. diff, the coronavirus, salmonella, norovirus and Legionnaire's disease. Infections in health and care settings can be spread directly via the hands of workers. The result of any spread of infections can cause distress, anxiety, further illness, inconvenience and ongoing concerns from the public. Localised infections affects one area of the body, for example a boil. Systematic infections that enters the body via the bloodstream and distributes throughout the body, for example the flu. Some pathogens attack skin cells, causing them to break down. This can appear as a rash. Some can attack the respiratory system and cause damage to the lungs, causing coughing. And we have a prime example of today of coronavirus. Other affect brain tissues or the heart. Those with underlying conditions, for example, heart disease, diabetes and lung disease, older people, babies and children are at the most risk of systematic infections. That means the entire body. A person feels ill as once it's inside the body as the pathogen damages the tissue. A pathogen is an organism that causes disease. Microorganisms are invisible to the human eye. The four most common types of pathogens are viruses, bacteria, fungi and parasites. The body tissue affected varies depending on the type of pathogen and how well the immune system reacts. Some pathogens attack skin cells, causing them to break down, and this can appear as a rash. Some attack the respiratory system and cause damage to the lungs, causing coughing, etc. For an example, coronavirus. Other affect brain tissue or the heart. Measles can affect the brain, and rheumatic fever can damage heart valves. Infectious diseases can be spread in three main ways: through the air, by breathing in infectious particles; through direct contact, by touching an infected person or their bodily fluids and not washing your hands; throughout contact with contaminated surfaces and not washing your hands. Signs and symptoms of some symptomatic infections: headache, high temperature, flushed appearance, chilled, shivering, lethargy or fatigue, nausea, vomiting, aching limbs, general change in behaviour. Considerations in relation to a virus. Antibiotics are of no use at all against viral infections, as mentioned before: HIV, measles, Hep B, mumps, chickenpox, coronavirus, influenza. It's been difficult to develop drugs to kill viruses. Some antiviral drugs can block the steps in the process by which viruses reproduce. A virus can enter the body by the same route as bacteria. Person to person, spread is common, so also wash your hands. Please always remember to wash your hands. Hand hygiene is the most effective way of preventing and controlling the spread of infection. It is the responsibility of all of us to cleanse our hands effectively. Alcohol hand gels are an alternative to soap and water, but alcohol is not a cleaning agent alone. When to know when to wash your hands. If your hands look dirty. Before and after an activity that could have dirtied your hands. Before any food preparation, eating or assisting with food. Before and after activity involving contact with an individual or any equipment, such as commodes. If you are supporting more than one person, wash your hands between each person. There are 5 moments for hand hygiene: before touching an individual, after touching an individual, before cleaning procedures, after bodily fluid exposure or risk, after touching patient surroundings. Please always remember to wash your hands thoroughly. Hand hygiene. Before washing, you should roll up your sleeves, Remove wristwatches or jewellery until you have a bare below the elbow. Nails must be kept short, clean and polish free. No false nails is acceptable. Avoid jewellery such as rings and wristwatches, as these can harbour bacteria. Cuts and abrasions must be covered by a waterproof dressing. Apply the chosen hand cleansing product after the hands have been moistened. For washing and rinsing, ensure the soap and water solution makes contact with all surfaces of the hand and then rinse thoroughly. For drying, make sure your hands are completely dry. Seek help from health professionals in case of prolonged skin soreness or a suspected allergy. Avoid contact with harsh chemicals such as disinfectants used to protect the environment. Hand washing facilities must be available and easily accessible. Basins should ideally have elbow lever operator mixer taps with adequate supplies of liquid soap, paper towels and foot operated waste bins. Improper drying can recontaminate hands that have been washed. Wet surfaces transfer organisms more effectively than dry ones. Products for hand hygiene. Liquid soap. After low-risk activities like changing bed linen and before applying gloves, this procedure would be suitable. Antiseptic hand washes. Again, this is added protection when performing invasive procedures like wound dressing and handling catheters, etc. Alcohol gels are 70% alcohol. Yes, they do destroy MRSA, but they do not protect against C. difficile infection. Providine iodine. This is used as a surgical scrub in operating theatres, and paper towels should be available to dry hands. The first line of defence, clean hands. Follow these 7 simple steps when washing your hands before and after entering a clinical area. Firstly, rub palm to palm. Secondly, palm to palm with fingers interlocked and around wrists. Thirdly, palm to back of hand and around the wrist. Fourth, thumbs clasped in your palms. Number 5, fingertips back and forth into the palm. 6, fingers clasped into palms, and finally around the wrist. And they are your 7 simple steps of hand washing. Hand washing technique with soap and water. If you sing happy birthday to yourself twice while washing your hands, then they do say that this is sufficient and your hands should be clean. But you can create your own song and sing for at least 30 seconds to whichever song you like. Personal protective equipment, again also known as PPE. These are used to protect both yourself and the individuals from the risk of cross-infection. Can also be required for contact with hazardous chemicals and pharmaceuticals. And PPE doesn't just include gloves, it can include apron, gowns, mask, goggles or visors. The regulations for PPE, the main one is PPE is to be supplied and used at work wherever there are risks to health and safety that cannot be adequately controlled in any other ways. PPE is properly assessed before use and ensure it is suitable for use. It should be maintained and stored properly and safely, and it's also provided with instructions on how to use safely. PPE is used correctly by employees. Disposable gloves. These can be made of latex or polyvinyl chloride, which can be punctured or leak. Wearing gloves for prolonged periods will induce sweating and can draw out bacteria. It is possible to contaminate your hands whilst removing gloves, so please be mindful of removing them carefully. Each pair of gloves should only be used once and once only. They should be the correct size. Generally they come in extra small, small, medium, large, extra large. They should be changed between supporting different individuals and different activities or procedures for the same person. So, example, if you're preparing somebody's lunch, then you would change your gloves for personal care and vice versa. Ensure you or the individual do not have any allergies to the type of glove. Gloves are not a substitute for hand washing and must be used appropriately with regard to guidelines. Use gloves before any contact with a wound and that might lead contact with a sharp or dirty instrument, such as needles, etc. When in contact with blood and any bodily fluids or broken areas of the skin, hands must be washed before and after removing the gloves. And remember the 30-second happy birthday rule. Disposable plastic aprons. These should be worn if there is a risk of contaminating clothing with blood or bodily fluids, or if an infection is already present. Also, they can be used for bed making or decontamination of equipment. They should be discarded as soon as the task is complete, and wash your hands, again remembering the 30-second happy birthday rule. Disposable plastic aprons should be stored appropriately as to not to collect dust, as they act as a reservoir for infection. Eye and face protection. This can include masks, visors or goggles, and they're used in the risk of blood or bodily fluid splashing into the eyes, mouth or face. Masks can be used for infection spread by airborne route, for example, respiratory syndromes. Masks should be disposed of immediately again after use. Safe disposal of PPE. New personal protective equipment must be used for each episode of care, and it is essential that personal protective equipment is stored securely within disposable rubbish bags. These bags should be placed into another bag, tied securely and kept separate from other waste within the room. This should be set aside for at least 72 hours before being put in the usual household waste bin. This is actually the current guidance at the moment for care homes in relation to the COVID-19. Laundry. Each organisation will have its own policy relating to the safe management of linen. Soiled linen needs to be kept separate from clean linen. Heavily soiled linen with blood or bodily fluids or infected linen needs to be placed in a red bag and placed in another bag, depending on your organisation's policy. Again, please also refer to the current guidelines relating to COVID-19. If a care worker supports the individual with laundry, then they should not take dirty laundry. This minimises the possibility of dispersing viruses through the air. Wash items as appropriate in accordance with the manufacturer's instructions. Dirty laundry that has been in contact with an ill person can be washed with other people's items. If the individual does not have a washing machine, wait a further 72 hours after the 7-day isolation period has ended. The laundry can then be taken to a public laundrette. Items heavily soiled with bodily fluids, for example, vomit, diarrhoea, or items that cannot be washed, should be disposed of with the owner's consent. Again, this is in current advice in relation to the COVID-19. The environment. Certain conditions need to be met for the microorganisms to grow: temperature, humidity, nutrients and oxygen. The environment may be on or in an individual, but it can also be in the water, on work surfaces or food equipment. It is important that infection control precautions are followed to ensure that work areas and equipment are kept clean and dry at all times. Environmental contamination may not always be visible, but it is present. The rule is, if you cause contamination, you clean it or ensure it is cleaned appropriately. Cleaning is used for low-risk areas and uses water and detergent to remove visible contamination but does not destroy microorganisms. Effective cleaning is an essential prerequisite to both disinfection and sterilisation. If workers undertake cleaning duties, then they should use the usual household products such as detergents, as bleach, as these will be very effective at getting rid of all the viruses on surfaces. Frequently touched surfaces should be cleaned regularly. Personal waste, for example, use tissues, continence pads and other items of soiled or bodily fluids, and disposable cleaning cloths. They can be stored securely within disposable rubbish bags. These bags again should be placed into another bag, tied securely and kept separate from other waste within your own room. This should be put aside for at least 72 hours before being put in the usual household waste bin for disposal as normal. Standard precautions: achieving optimum hand hygiene, using personal protective equipment, PPE, safe handling and disposal of sharps, needles, injections, safe handling and disposal of clinical waste, managing bodily fluids and bloods. Decontaminating equipment, achieving and maintaining a clean clinical environment, the appropriate use of indwelling devices, managing accidents, good communication with colleagues and those that support you and visitors. Handling disposal of waste. All workplace areas have policies for waste disposal. There are specific colour bags for different waste materials. Yellow bags for clinical waste, black bags for domestic waste, grey or special bins for glass and aerosols, and colour-coded bins for pharmaceutical or cytotoxic waste such as cancer treatment or medication, etc. Disposal of waste. A risk assessment, as required by the COSH of 2002 regulations, should be carried out on any waste generated. Clinical waste includes waste containing blood or other bodily fluids, swabs or dressing, syringes, needles or other sharp instruments, which unless made safe may be hazardous to any individual coming into contact with it. The Environmental Protection Act 1990 must ensure that there is safe working practices in relation to disposal of waste. Domestic waste, black bag goes to landfill. Clinical waste, contaminated with potentially infectious materials, will go in the yellow bags for incineration. Sharps will be in a sharps container sent again for incineration. Cytotoxic substances, purple bags or boxes. Glass referred to organisation policies. Decontaminating equipment. Inadequate decontamination can be associated with outbreaks of infection. It is vital that all reusable equipment or furniture is decontaminated between use. Decontamination is the combination of cleaning, disinfection and sterilisation. The method used will depend on whether the piece of equipment is low, intermediate or high risk of contamination. Disinfection. This is a deeper, more effective process than cleaning, which will reduce the number of microorganisms. It may not necessarily inactivate all viruses and bacterial spores, but disinfection uses chemical agents or heat to reduce the number of viable organisms. The use of disinfectant is governed by the COSH regulations. Sterilisation. This process destroys all microorganisms, including bacterial spores. Sterilisation can be achieved by either using a specialist service or benchtop vacuum steam sterilisers. These must comply with regulations and must be checked annually. Trying to reduce your chances of getting sick? Encourage any person coughing, sneezing to wash their hands or use alcohol rub. Coughing and sneezing etiquette, use a tissue. Wash your hands frequently. Wipe down counters, pens, phone, computers, keyboards, etc. with disinfectant cleaner as and when needed. What do you need to do? Have an adequate supply of resources available, such as tissues, alcohol rub, face masks, waste bin with a foot pedal to lift the lid for disposing of tissues and masks, etc. In order to maintain good health, avoid close contact with people who are ill. Stay at home whenever you feel unwell and follow the current government guidelines. Cover your mouth and nose with a tissue when coughing or sneezing. Avoid touching your nose, mouth or your eyes. And again, wash your hands as often as possible with soap, water and alcohol rub. Again, singing the happy birthday 30-second rule. Remember, catch it, bin it, kill it. And again, please remember to wash your hands thoroughly. Thank you.